Hello and welcome at How Roche Unblocks Value at Scale with 1100 self-managed adaptive teams. And today with me here is Hemerson Paes. Thank you for joining.
Thank you too for having me, Julian.
Really looking forward to this chat. I want to welcome everyone who is joining live on LinkedIn and everybody who might be watching after the fact through the recording. And a special welcome to our leader roundtable community. We have about 200 leaders that often join us in these events that we host every 6 to 8 weeks. If you want to learn more about that, stay tuned toward the end of this session. We're going to use the chat a lot today. So if you are in LinkedIn chat, it would be helpful to share where you're from if you're watching live. It's always nice to hear a bit more about where everybody is from. And we can also use your chat throughout the session and put some questions here, because it's not all about sharing the story. It's also about hearing from the community what you want to learn. And Hemerson is here to answer our questions. And before I'm going to dive into the actual content, I'm going to share something a bit more about these roundtables and the connection to Unblock and our book. Unblock is a modern change consultancy. It's co-founded with myself, Koen, and Nelia. They'll be also active in the chat, so the welcome is from them as well. And we focus on three main things. We help clients do strategy, execution, and alignment really well. We focus on organizational effectiveness, whether that is unblocking organizations from slow decision-making or meeting cultures or anything else. And we help leadership teams to develop. If you want to find out more about our services, you can go to the link on the screen here. I also have a new book out. This was also the connection point to the story at Roche and what Hemerson is going to share today. It covers 6 areas where organizations can be blocked. And especially around ownership is where I reconnected with the story of Hemerson. The thing is, we have here in many organizations, we have the situation where when you have a great idea or you see something that is good for business and you want to get it done, you have to run it up the management chain. And unfortunately, the reality is that a lot of things get cut down. Like this is Tom Fishburne's comic, Death by a Thousand Cuts, right? There's a lot of great ideas that are dying in organizations because we don't have the structures in place to support them and to enable them to flourish and bring to life. So when I was working with Roche many years ago, I had an opportunity to work in one country organization. And we were helping teams to be faster and get better. And then I suddenly learned that there was another thing going on, which was completely outside of the hierarchical structure that we were working in, that was going on a global scale. And that's how I met Hemerson, who, as you saw in the title, has been able to grow over 1,100 self-managed adaptive teams at this company. So Hemerson, maybe you can introduce yourself a little bit and a bit about Roche.
We have a 1-minute video that we can play as a brief introduction to the company. And then I can introduce a little bit about myself as well as we go along. So Roche is a pharmaceutical and diagnostic company with a presence in over 100 countries. We deliver innovative medicines to 20 million patients worldwide. And in the pharmaceuticals where I work, we provide innovative treatments in 5 therapeutic areas. I mainly support the pharmaceutical customer-facing teams, the amazing people that are present in 89 countries, excluding the US and Japan. So I'm super excited to be here today. This is my first live stream on LinkedIn and with Unblock. And I also hope to learn a lot today. Super honored to be joined by many colleagues from Roche and other companies. Please join the conversation, chime in the comment. The purpose is to remove barriers and build bridges between teams and functions so everyone can get access to the knowledge and the expertise they need to benefit the patients. I create the conditions for people to access other people, to access knowledge, to get information that accelerate their mission. In practical terms, the initiatives I lead bring the future of work to present day. So that's about me.
Can you say a bit more about the adaptive teams and the marketplace you've built? Like how does it start? How does it work?
We call it the opportunity marketplace. The best way for us to understand the opportunity marketplace is to understand the dynamics and mechanics of the adaptive teams. Mm-hmm. And the best way to do that is to start with a real case. Ian is sitting on a conference call in the high-rise building of our Singapore office. He's listening to a colleague from Indonesia tell the story of Sari, who lives in Manado, countryside of Indonesia. Sari is undergoing treatment for cancer. She is hopeful and the prognosis is good, but the results are uncertain. Besides a cure, there is only one thing she wishes for more: It's quality time with her loved ones in the comfort of their home. However, traveling to the treatment center takes 5 hours, door to door. A single visit for therapy means a full day away from her kids, an enormous burden to the family. She cannot go alone because she's very debilitated after the treatment. Her sister usually accompanies her, and because of that, her sister also has to give up her job for the moment. At home, their mother takes care of the kids. Imagine going through this every other week. The physical discomfort of traveling back and forth in pain, wondering how many days more would you have with your family. Regular visits to the hospital are a high cost for Sari and her family financially and emotionally. But then there is Ian. Ian's the customer-facing team member in Singapore, where home-based care is well accepted. His professional life is relatively straightforward. After hearing Sari's story, he realizes how home-based treatment could improve the lives of millions of patients. Many patients in Southeast Asia face enormous physical, emotional, and financial burdens due to the lack of access to home-based care. He realizes that by empowering the healthcare practitioners in these countries to adopt home care practices, he could help dramatically improve patients' lives like Sari. However, Ian has no authority. He's just a sales rep. He doesn't have budget, has no personnel reporting to him in Singapore, even less in other countries. All he has now is a vision to create a change. And he starts doing exactly that, sharing his vision. He shared his vision with colleagues in Indonesia first, and they're inspired. They wonder whether others could join the effort. So they create an opportunity in the marketplace. They describe the objective, getting Singaporean doctors and nurses to share the best practices about home-based care across Southeast Asia. However, posting the objective is not enough. They need to get skills. They need to get people with expertise. They need to get support to make this happen. So they start reaching out to multiple colleagues in their network. They're also very strategic about the stakeholders they need to engage. So they recruit people with good relationships with these stakeholders. Ian begins to build support. After several discussions, he gathers 7 colleagues from different countries to join his mission. Together, they set out to improve the skills and knowledge of healthcare practitioners across Southeast Asia. They convinced doctors from Singapore to join their mission of sharing best practice about home-based care. However, they still have to navigate complex internal bureaucracy, find funding, and overcome external system barriers. They push through because they want to make an impact. Ian and his team managed to put together resources from various cost centers, and they succeed in expanding home-based care practice to 8 countries, including Indonesia. Patients like Sari can now receive treatment at home, reducing the physical and emotional strain to their families. Those 8 colleagues realized that cross-border collaboration could achieve an impressive impact. So they disbanded the team, and now each member forms a new team, seeking to address different challenges or opportunities. This is how adaptive teams work in the opportunity marketplace. They set up based on outcomes and not on the functions or departments. The adaptive teams, they're not formed around administrative structure, a department or a function. We commonly see people organized in departments. However, a company is primarily a group of people that works together. Companies are actually mostly people that want to work together. The walls are fictitious. The department, the divisions are illusion. So when people are given the autonomy to define the objectives, they move beyond those formal walls that separate functions. And they self-organize around an outcome, a mission. For a limited amount of time, they pursue that outcome that impacts the business. They're not there representing a function, they're there addressing a need. So this is how the opportunity marketplace works in its more rudimentary form. Anyone can recruit to work towards a specific deliverable for a limited duration. Anyone from any hierarchy or administrative level can post the opportunity, no approval is required, and anyone can volunteer to join any opportunity in the marketplace for 30% of their time. The platform does suggest employees with the needed experience, and it's like in the case of Ian, the most successful teams actively recruit through their network. And for that, they use what we made available, a network map. So we moved from a centralized structure, spoken hub and collaboration, where only 5% of collaboration happen across countries, to a network structure where collaboration is visible. So we provide every participant employee in the opportunity marketplace with the private online network map, which is updated quarterly. In this chart, every dot is a person, every connecting line represents a collaboration in different projects. It shows the connections 2 to 3 steps away, much like LinkedIn, but with more context about each connection's experience in previous projects. So boundary spanners experts like Ian, they are no longer hidden in the organizational chart. And because people now can find projects and who to contact, collaboration across borders increased by 10 times to 57% of all collaborative efforts. So these are the 1,100 self-managed teams organizing themselves in 14 communities, collaborating shared opportunities beyond borders and boundaries. We estimated a financial impact of around $560 million based on combined revenue growth and productivity gains. So today, everyone knows who is working with whom and in what, so they can reach out to learn faster about new ideas and learnings or experiences. So in LinkedIn, you just connected to someone, but in our network, you must have worked with someone in a project or an opportunity to be connected. Mm-hmm. Today, over thousands of teams like Ian are forming to address these challenges and to pursue new opportunities. This is in a rudimentary form.
Yes.
Opportunity marketplace in 5 minutes or less.
People will probably understand by now why I wanted to have you on stage, because this is such a mind-blowing idea and construct, and you're proving that it can work at a huge scale. I have a lot of questions. One of them is, you started with Ian, who has a great idea and want to get something done for patients. They publish a mission, an opportunity, and how does that work? They put something on a message board and say, hey, I love to do this. How simple or difficult is it?
It's as simple as that. They define the impact they want to create. They list which kind of skills are needed, so they can use the platform to search for people who have the skills needed or the past experience, or, which is most common, they reach out through the network to know people that want to work on that. In the case of Ian, it was straightforward. People that are working in the customer-facing space in the other countries, or colleagues who work in medical education in other countries would be the very first target. But also he needed other types of support as well. So yeah, it's that simple. The recruiting is the difficult part because they need to be strategic about who joined the team, need to have certain kind of skills, but also commitment. People are going to these opportunities not representing the department. They are there because they are attached to that outcome, or they have a specific skill sets to contribute.
So how does that work then? So there's a opportunity, and is Ian the one who says, I want you in the team or not? Or is there another mechanism for selecting who is going to join that specific opportunity?
It's Ian. We have already thousands of teams, so we also have an ability to see members in the team, the number of hours dedicated. We have done a lot of research with those teams. We can understand the impact they bring, the financial impact, the no financial impact. So more often than not, in case Ian, he didn't start alone. He heard the story and he reached out to someone that already has a stake on that result with the colleagues in Indonesia. People have an idea, they check with 2 or 3, and they say, okay, we kind of in ballpark, correct? Do you want to form a team? And there you go. You already have 2 or sometimes 3. It's easy to get more people when you have 3 than if you're alone.
How do these teams get funded? I mean, you said people can spend 30% of their time on this, but I imagine it's not only time that they need. They might need other funding as well. How does that work?
So they are very creative about funding. This is a piece of the structure that we didn't solve yet. The financial allocation, the budget are still on the formal structure, vertical allocation. And they get creative either on finding solutions that are simple to address, or they go after the funds needed from the parts of the organization that will benefit from the results as well. Still, many of the teams are able to unlock a lot of value. One of the principles is purpose alignment. So individuals align their individual purpose to the team and to the organization as well. So people are not creating opportunities for rock bands, like the company has a mission. People naturally align those purposes. We can read all these opportunities, so it's easier to see that they all align to the business objectives. But also individuals need to align to their own purpose towards those objectives. The objectives need to be transparent. So they cannot just create an idea and start doing. They need to make it visible, so they need to recruit. So that in itself already create a commitment and a level of responsibility. Nobody's going to make visible an activity that is not aligned with the company objective. We need a transparency of skills and capabilities. So it's very difficult to find who to join the opportunity if those skills are not visible. And even if people don't have those skills visible in their employee profile, after they participate in the opportunity, automatically is absorbed in their profile. So with time, the skills and capabilities become visible. And the teams need to have a certain autonomy. As you illustrate in your chart, if they have to go through lines of approval to get started, they learn nothing. So seeking for budget and approval, it happens in later stages when the teams are certain of the results they will bring.
Right.
They have tested a hypothesis with customers. They have generated a minimum viable product already with very little funds. And then if things need to be scaled, then they go through the normal approval process.
That sounds healthy, where a team can try something small first without a lot of budget needed, which is already very different from what I typically see in organizations where it's like, oh, we have this idea, we need to get funds before we get started. But now with these teams, they actually grow into something if there's a reason for it to grow. So that's interesting. And so when Ian, as an example, posted, there's no review committee, or it's a full transparency, not like Hemerson or somebody else saying, you know what, this is not fit to our purpose. It's expected that people will do it themselves, right?
Yes, there is no review committee. Anyone can post any opportunity. Anyone can volunteer to join any opportunity, dedicating 10 to 30% of their time. People are invited, or they are recommended to make it transparent for their teams, for their administrative teams and their line managers. But also they are free to apply to opportunities, because also it's not certain that they would be selected by the team. And in reality, we have more people willing to participate in opportunities than opportunities that are available, because it requires a certain kind of courage to put yourself out there. Today, the number of hours dedicated to opportunities equates to only 5% of the full-time equivalent. So we have 13,000 employees in 89 countries. The number of participation in the opportunity marketplace equates to 650 full-time equivalents, but these are spread at around 3,000 employees, because it's 10 to 30% of their time.
And just to give a whole sense of the scale, like how many people work at Roche globally, totally?
Globally, the Roche group is around more than 100,000 people.
So I have a good question from Roshan. I'm going to putting it on the screen here. So he asks, how many teams or initiatives would individuals be committed to at the same time? Is it just one, or can people do multiple teams at once?
That's a very good question, because in reality, even before we started the opportunity marketplace, we did a network analysis, and we found out that people were already involved between 5 to 7 simultaneous projects. Those projects were not visible anywhere. They were not in the department, they are cross-departmental, cross-team, and there was no visibility about those projects. Now, today, we have this visibility about opportunities. And yes, people participate in multiple opportunities at the same time. Depending on the challenge that they are tackling, they should dedicate only to one opportunity. But yes, many people participate to 2 to 3 opportunities at the same time.
But the rest of the time, they're still working in the regular hierarchy, right? Is that correct?
Yeah, the rest of the time, they are officially working the hierarchy. We did another survey in the end of last year. The survey was about to find how people were accepting this opportunity marketplace, how are the interaction there. And we wanted to find out what is the result for the employee in terms of reputation, in terms of connections. And it was very interesting to see that people that participate in the opportunity marketplace had 4 times more recommendations from other colleagues as critical contributor to the activity than people that did not participate in the opportunity marketplace. So many people spend a good part of their time participating in opportunities. I would say half of their time are in the administrative functions, but these also involve other projects which are not visible in the opportunity marketplace.
Yeah, that feeds right into the other question that I see here from Nathaniel. How do you encourage that the reporting line managers in the hierarchical part of the organizations don't get in the way or intervene with the autonomy of the roles-based initiative work? And I can imagine if you're super busy on this autonomous team and you're really engaged and you're really excited about that, your normal work might suffer, right? And then that might cause some tensions. Is that true?
It's true, there are tensions, But the tensions do not arise between people participating in these autonomous teams. It's just the tension on whether that activity was initiated by the department or not. With time, the smart people that participate in the opportunity marketplace, they are able to align the initiatives they participate to the mission or to the objectives of their functions as well. And it's not difficult. Case in point, Ian, his job is to engage with external stakeholders, with doctors and nurses. Right. His work projected those doctors and nurses from Singapore and create a strong bond of relationship between Roche and them, which makes easy for him to get access to those doctors and nurses again and are decision makers that they can influence.
Yeah, so you're also saying that people can use this opportunity marketplace to fulfill their quote unquote normal jobs in a better way, to create outcomes in their local markets that they couldn't otherwise do without these adaptive teams.
Absolutely. And many smart line managers understand that they need a certain set of skills, and they need to develop a little project on the side to improve the efficiency of the team or anything else. And they are smart enough to set up an opportunity, form an autonomous team to solve for a problem that he or she may see.
Yeah, I'm also curious. So Ian sets up this team. He's able to recruit members from across the world. He starts a Google Meet meeting, asks everybody to join on Monday at a certain time to start talking about the work. What else? Like, are there any guardrails or organizational practices that these people use by default? Are they trained in any way to work together globally without knowing each other? Are there any standards in place? How do you get these teams to collaborate quickly?
So the teams do follow very few principles. I mentioned to you, transparency of objectives, transparency of purpose, transparency of the results of the work. Out of that, the teams are very free to define how they want to work together. Mm-hmm. Now that we have 3.5 years with this system in place, we are able to understand the 9 practices that the high impact teams adopt. And we don't define them as guide, but we provide them as a guide. For instance, the first thing is number of team members. So 94% of the teams are composed between 3 to 9 members. There is no restriction on how many team members they could brought in the opportunity. In practice, for communication to be effective, they select 3 to 9 members. And also the duration of the work is between 3 to 9 months. There is also no restriction. They could keep the opportunity to running for quite a long time. But the most impactful teams limit that duration, so they are able to scope smaller contexts, smaller objectives that could be delivered in 3 to 6 to 9 months. They also bring people with diverse skills. They're coming from different functions, very much like Ian has done. So the most high impactful teams have this diversity. We developed 6 machine learning models to go through the data that we have. And the diversity of skills is the one that predominantly appear in all the different scenarios that we also interviewed the high impact teams. And especially we are mostly interested in the ones that are collaborating across country, because cross-country collaboration, it's harder. The problems are much bigger, much more complex. You have team members from different cultural backgrounds. They are solving problems in different contexts that not always align. How they make the work feasible, how they communicate to each other, how they organize, how they solve the problems, how they make decisions. And the third thing that is very important, they don't leave trust building for chance. And most important, dependability-based trust. Based on these collaborative norms, they create moments, or they create situations or rituals and rules that actually help the build trust between team members, knowing that they can deliver, knowing that each one will step in when it's their time, or if it is not their time, they'll call for help. And if they cannot do, and they'll get the help they need. So that trust, that transparency is always a critical factor. So these are the most prominent practices, Jim, but I think we can do another live stream talking about 9-1.
Yeah, but I'm curious, how do these teams work on trust? You say they're not leaving it by chance, but what do they do to create trust quickly? Do you offer them a set of things they can try, or is there a coach helping them out? What support do they get?
We don't have coaches dedicated to the teams. We just now start working with an AI-based coach. We taught this AI coach all these 9 practices, and we just launched it. So it's very early to see how teams will be reacting to that. Some of the teams use coach, other teams just stumble upon those practices from somewhere else and they start applying. And we can see a strong correlation between those practices and the high impact they generate. Teams that do not use those practices tend to be in the lower range of potential and impact.
Yeah. Can you say a bit more about these practices? So you said like the individual outcome, the connection to the individual outcome, collaborative norms. Like what are the 9 practices? Is it possible to list them?
I would need more time to go through them, and in the
Yeah.
illustration I will put in a slide. I haven't prepared a slide for that. Defining shared mission is the very first one.
Yep.
Second, define the collaborative norms. Third, building trust is almost the result of all the other norms. It's identify knowledge gaps. Identify what's the expertise of each of the members and where the knowledge gap need to be addressed. And then create conditions for bridging this gap, either by creating shared artifacts, like a prototype is a shared artifact. So everyone starts understanding the different perspectives, stakeholders, external stakeholders, involving external stakeholders, and the ones that will benefit from the solution early on is one of the good practices as well. They define the forms of celebration, rituals of celebration, because they want to create also a shared identity among the team members. So even it's for a short duration of time, these people, when they disbandle, they still remain connected. The bonds still remain strong for quite a long time, because they work in a very challenging opportunity or problem. Some of them go to the extreme of creating a brand for the team, a name for the team.
Yeah.
Many of them create lessons learned pages where they do the retrospective and they make that public and visible. So this is another practice where they regularly reflect on how they interact as a team and improving on those practices.
It gives a sense, as people who are following us know, we are very much into being intentional about the practices that a team is using to get to high performance. And I think it's just even more true if you're collaborating with people from different geographical cultures from all across the world you've never seen before, and you want to create an outcome within 3 to 6 months, right? You really need to do some stuff to work on that team and to be effective. It sounds like you're working there, and I should probably get that AI coach to work with me as well. Because as a coach myself, there's a world out there where you can scale your impact by training really good AI to help you out.
It's still an experiment for us, because the question is, would be an AI coach incentivize the conversation between team members, which is the critical piece, rather than hijack the individuals to have a conversation with the coach, which is not so helpful for the team.
I have another question, which is about how are these teams held accountable, or are they held accountable? Like, who's reviewing the output of the team and either giving them a thumbs up, or is there some kind of sponsorship happening, or is there somebody who will intervene if there's nothing coming out of it, or is it all self-regulated?
The accountability comes from transparency. They post what they want to achieve. They also make visible how far they progressed. Teams that honest as well in saying, well, we tried this and did not work. Here, the most important is whether people are learning and progressing on the objective they have, the bigger mission they have. The result would be phenomenal if they have learned something and if they have built up some knowledge and expertise and understanding for the next step.
I have a question here from Damien about how this was introduced and the challenges and how quickly it was adopted, because this has been going on for many years, right? This is not something that you did in the last half year. I think it must have been 5 or 6 years already that you're doing this, maybe longer.
Yes, 4 years. The introduction was in stages. The intention was always to improve collaboration across markets. And the first thing was to understand, was there any reference points we could build on? And how could we learn from the collaboration that already existed? That is one of the first steps. We start by understanding the culture, understand who are the key connectors, who are the people that are more influential in the organization, which just by a warning are not necessarily in the organizational chart. People that are really trusted, 3 to 5% of the employees, they are not necessarily in high positions in the organization. They are those people that you talk on the water cooler on the old times, but today is more like you have a one-to-one chat on Zoom. And we also work a lot with them to learning what were the conditions that made it more suitable to adopt this practice. For instance, principles I just mentioned, they all were learned from them. the practices of high impact teams was not 6 people in a room that came up with that. We researched 1,000 teams, we interviewed 30 teams that were high impact, and we consolidated what we learned from them. Therefore, our approach is always to learn from the organization, learn from the people, observe, implement interventions, and learn from those interventions, adapt, and so on and so forth. So there are many iterations for us to introduce and get to this point.
Was there one person or one department who said, let's try this out and formalize this a little bit? Or were there any challenges where the formal hierarchy resisted this idea? What would you advise others if they want to get started with this? What have you learned about getting started that is helpful for others to know?
I was always advised is learn about the current culture and the context and identifying the points of least resistance. Identify the cultural elements that are more propitious, that you can build up rather than eliminate. In our case, collaboration was very strong. The willingness to work in a purpose, in the mission of the organization was very strong. And instead of just setting a shared pool of resources, we have found that people already collaborating across the departments in the countries. So we just created a place, a platform where people could do what they are doing just in higher scale and make it public and make it visible. Observe, learn, decide, and then adapt.
But I also have to acknowledge probably that it can be scary for the hierarchical managers. There's a certain mindset that can control things top down and you want everything in order. I don't want to release, quote unquote, release some of my people for 30% of their time. I can imagine if when this was introduced at scale where everybody was suddenly allowed to spend some of this time on that, some people might not be happy. Did you get through that phase as well?
Absolutely. This is very interesting because on that research where we're doing the diagnostic, the analysis of the level of collaboration, we also measured the level of autonomy. And we could see that across the border, there was very few exceptions, but across the border, everyone had a lot of autonomy already. So meaning the line managers were not the gatekeepers of collaboration across teams. You didn't have to go through the line manager. If you have a line manager, I didn't have to go through your line manager to invite you to participate in an initiative. I would already have reached out to you. And this is way before we had the opportunity marketplace. So our assumption was if we let people do what they're already doing, just make it visible. That was one of the assumptions that immediately was removed from our team, the team that was working on that. We thought the managers are the gatekeepers. They are controlling everything. We need to act with them. It was not the case. But you are right. Just the visibility of what is happening already was a wake-up call. The tension comes from, as a manager, you will have certain expectations established by the formal HR practices, which does conflict with people participating in opportunity marketplace. On the other hand, now it's visible. Now that participation for the employee is visible to the manager, which before was not, and it's visible for the employee and it can be added in his or her career development and career plan and performance review. So it's actually more structured than other way around. The autonomy hasn't changed much. Now, if you are doing the same in an organization that it's very autocratic, top-down command, probably you need a different approach.
There's two other questions that are related to this. One of them is from Nathaniel about conflicts. So if there's deadline conflicts or priority trade-offs between the hierarchy and the adaptive teams, how do these conflicts of interest handled? What should take priority? How does that work?
So unlikely one of the adaptive teams will have an initiative that will conflict or have different timeline than in a management structure. It happens to an individual level. This is true. And adaptive teams are easier to adapt. That's part of their job. They know how to do it very well. So team members that see themselves in a difficult situation because now the line manager wanted them to drop the adaptive team and just dedicate themselves for whatever is urgent now in the department. Well, the adaptive teams, guess what? They adapt. They get another member. And this is very, very common. It's one of those practices that it's unique. It's not only in the company, also in family life. Private life happens. People get sick and people just say, hey, I can't participate anymore because this and this and that. The team actually accept that. They embrace that. They provide support to that person, sometimes even offering help to free your time. Mostly, they already prepared. They had pair work on the deliverable, so then one person can take over, and they also recruit new members for that. Because they are acting faster in situation. The administrative structure is a little bit difficult to do that because of HR practices, but adaptive teams, they are easy to adapt.
That connects to a question from Mara. How does Roche recognize and reward employees that are contributing in these adaptive teams? Is it something their manager has input to?
The most recognition people get are from the people that benefit from the result of the adaptive teams and from the adaptive teams itself. So we use a system in Roche with peer-to-peer recognition, where people can award points that then can be exchanged to services or goods or products. This is the most dynamic form of recognition. Also, the teams themselves, they make sure that they acknowledge the contribution of each team member. They have rituals for that. There's very structured. I'm not saying all teams do that, but the most successful ones, they don't leave that for chance. It's actually planned in their work to recognize and to acknowledge contribution. So, and in that survey we did in the end of last year, we also found that the reputation for knowledge, expertise, innovation spreads 4 times faster through the participants in the opportunity marketplace than those that did not participate. So this is the most common ways that they are recognized. The line managers can still consider the employee contribution to these adaptive teams in their career development, in their performance review, because it's in the system. It's not hidden. It's there in the system and they can see, but that's prerogative of the line manager to decide how to take that contribution.
That makes all sense. So there's a question here from Oscar that's really a bit future oriented, which is about the future of this. Do you think that this opportunity practice will eventually increase the percentage allocated for it above the current 30%? I even wrote it down for myself. Is this eventually going to eat a hierarchy? Or is this probably going to be an equilibrium that will stay like this? What do you think?
Very good question, Oscar. My gut feeling is that the future of work is actually hybrid and multimodality. After studying these 1,000 teams and seeing the high practice, the commitment they have, I don't think it fits in every organization in every single conditions. It's excellent for situations of high complexity, require high level of adaptation, innovation, introduction of new products, things that really require diverse skill set. For industries that are probably low margin, very stable, process oriented, and require a lot of efficiency in gains in production or manufacturing, for instance, probably is not the right structure. So I think organizations will operate with a dual structure in the future. And I do not know if the threshold is 30%, 35%, 50%, but it should be aligned with the business objectives, basically.
I know that Roche has a big country focus. Every country has its own management team and people reporting into those general managers. And then those people are also for 30% working outside of the country or across boundaries. But can you eventually imagine an organization where there's maybe thousands of people, maybe not all of them, but maybe thousands of people are just full-time on multiple adaptive teams and they just don't work in the hierarchy anymore? Can you foresee that?
I can foresee if aligned with the business objectives of the company, if it fits the industry of the company, I think it's possible. It requires a different mindset. It's an entrepreneurial mindset. Ian had to say, I see this problem, I want to solve, and I'm going to try to find funds for it. I'm going to recruit people for that. You know, not everyone is willing to risk that much. It could go wrong. How you deal with that, right? It's easier in a formal structure. It's easier to say, oh, my manager asked me to do this, and that's why it went wrong. So I think it's different, requires a different setup.
Imagine Ian is able to negotiate this with his line manager and say, you know what, I want to work on multiple of these initiatives. I want to scale down my regular work in the hierarchy to 10% or maybe 0%. Would that be already possible, or is that constrained somehow?
This is possible. On the survey we did in the end of last year, we had many people that said 90% of their time is in these teams because they're working projects, right? And they already figured out they can spend 90% of their time in 2 or 3 projects, and that's it. It's possible. It's possible what you mentioned, Julian.
We're going to close down with a few final words. Is there anything you would like to add that you haven't said already, or any request you would like to make to the people that are seeing this?
I would be curious to learn from companies that are trying to do something like this, and keen to learn on what they are going through as well. So I'm happy to be contacted. You can contact me on LinkedIn.
People want to learn more from you. I saw already a request for the 9 practices. I'll definitely get back to you, Hemerson, maybe get some more information for an updated version of my book. About the book, you can grab your copy. There's a whole chapter with more organizational practices like this one, other cases from other companies that are trying similar things around mission-based teams. So go to unblock.works/book to pick up a copy, or just look in Amazon or wherever you usually buy your books. I promised a special offer for people who are here. If you are going to buy a book and you're willing to leave a review on LinkedIn, Goodreads, and or Amazon, send us a message and I'll happily send you another book. That offer still stands until the end of the year, and that includes my first book as well. So you can either give it away or get the other book for free. Finally, this is one of the sessions of the future-oriented leader roundtables that we are running. This one is a format of a LinkedIn Live. Quite often, we also do closed sessions with more reflection and breakout rooms, specifically for leaders in organizations, VP level, business engineers, business unit leaders, those kind of things. So if you're curious, learning more about that, you can go to unblock.works/roundtables. And if I can get you back for a second, Hemerson, I'd love to just thank you again so much for joining. So to close, I'd really love people to share their takeaways in the chat. I'd love to thank everyone for participating, and we'll continue to be active in the chat. And Hemerson, thank you so much for these insights. Thank you so much for all the work you're doing, your brave pioneering into this world. And I'd love to learn a lot more from you. So well done, and see you next time.
Thank you. Thank you very much. See you next time.